Starting today, the mental health of 250,000 young Canadians became a higher priority. A new initiative has been launched because overwhelmingly students say they are dealing with issues of stress, anxiety, depression, and even thoughts of suicide. More than 700 students in Toronto's public schools say they attempted suicide last year. Staff are now receiving training to help kids in distress. That's important because 70% of mental health issues have their onset during childhood and adolescence, illnesses that will afflict 7 million Canadians this year alone. Joanna Remiliotis looks at why helping at school is vital. Joanna.
Peter, the Toronto District School Board says its goal is urgent, to help its students before it's too late.
Feeling your right leg deeply rooted?
Tucked in the back of a high school library, a spot where students can stop long enough to breathe.
I find it really good because I find that I get stressed out about just like simple projects that I can do that aren't really a big deal.
For me, the yoga helps me to deal with those emotions when the depression comes up and when the negativity really comes out.
Depression, anxiety, students' mental health is something educators are talking about more than ever. Helping them find balance is now part of a 4-year strategy for Canada's largest school board.
All schools and their teams will address the symptoms and the anxieties and the depression.
The board plans to train all of its nearly 40,000 staff, including the lunch lady, to identify red flags. All 600 schools will have a mental health team, and all high schools will have anti-stigma programs to combat devastating issues like bullying.
We need to make a difference. We need to look at the results, and we need to find ways to address anxiety so that we can improve student success.
The trigger was the board's own research, a survey that found a majority of students reported feeling nervous and anxious, to the point that nearly 40% felt they couldn't cope. From yoga to mindful meditation, teachers at this school are already trying to slow down racing minds. They welcome all the help they can get.
But when you're sitting with a kid in anguish, you know that something needs to be done. And you can refer them, but they're still going to be in your class the next day.
Experts say the TDSB's strategy is promising, but say it's also critical to embed mental health in the actual curriculum. Last year, Nova Scotia mandated it in all its high schools.
We teach them how to teach a mental health curriculum, and by so doing, we utilize their natural strengths and abilities, and wow, do we ever see good results.
And the results can be life-saving. More kids opening up and asking for help. Ontario is considering similar changes to its curriculum. Peter?
Joanna, why is getting young people talking especially important these days?
As a group, young people are the least likely to seek help. At that age, it's all about fitting in, not wanting to be different. It's why everyone agrees schools play such a crucial role in teaching them that they're not alone. Peter?
All right, Joanna, thank you. Joanna Remiliotis here in Toronto tonight.